Hello, I'm Dr. Craig Werner, a chiropractor with an office in Longview, Washington. This video is about headaches and how to manage them. The beauty of this medium is that if there's something you want to recheck or get a better look at, you can hit pause, back up a few seconds, and replay. At the end of the video, I'll put up my office phone number, which is basically a direct line to me. If you have questions about headaches, muscle pain, joint pain, it's the kind of thing I've been doing for 30 years. Headaches are probably the most universal ailment mankind suffers from. Everybody's had a headache at some point or another. The research shows that better than half the population of the planet will have a headache at least once this year. That's like 4 billion people. Many of them will have a lot more than just one. Headaches have a lot of different triggers, but in the healthcare community, we try to categorize them so that we can all be on the same page when we discuss them. First of all, we would talk about primary headaches. It's an all-in-your-head type headache. It's not the result of something that has happened outside that is then affecting you. Overactivity of structures like muscles and vessels and even nerves that have gone off firing for no reason. These things can all produce headaches. A small percentage of these are migraines, but most are not. Secondary headaches are results of other issues, something that's going on outside of the head. Things like hangovers, bleeds in the brain, brain freeze, carbon monoxide poisoning, raging headache with that, stress, noise, excess sunlight, and of course there's always the loss of affection headache. You know, not tonight, dear, well, never mind. Migraine headaches tend to be a woman's issue more predominantly. Men do get them, even young boys get them. But more commonly, about 70% of the time, it's a woman's or a young woman's issue. There are two types of migraines, the common migraine and the classic migraine. The classic has the aura or prodrome. It has a pre-notice that there's a headache coming on. It might be what they call floaters in the visual field that you know aren't there and yet they still show up. Sometimes it's a hum or a noise or an odd smell that you might get that truly is not present for anyone else. And this is a notice to the sufferer that they have a migraine coming on. There are many things that trigger migraines. Most commonly, it's cervical subluxation, which is the neck and the head being dysfunctional in terms of the joints not moving well, causing irritation to the nerves around them and setting off the headache. And hormonal changes, which is one of the most common for especially young women, those few days before the period when the estrogen levels drop off and it just sets off the headaches. Very common. Cluster headaches are more a man's issue. Again, women get them, but in much, much smaller numbers than men do. Cluster headaches are severe, grinding pain, and they usually occur in the middle of the night, between 2 and 3 in the morning. I've seen videos of a man literally on his hands and knees beating his head against the floor because it hurt less than the headache that he was suffering did. They're almost always one-sided, unilateral, often behind the eye, retroocular. They can happen anytime, but late at night is the most common occurrence. And then there's the thunderclap headache. This is one that just bang, hits you right now. It's usually over with in a short period of time, of several minutes. Or the worst of it is. But this is a headache that's not to be messed around with. Call 911 because it's oftentimes a notice of a stroke. There are two common structures that are involved in most headaches. The vessels, the blood vessels in the brain and in and around the neck, they're impacted by tissues that are nearby, bony tissues but not so often bony tissues as soft tissues like muscles and ligaments. And by chemicals, things that will cause a vessel to dilate, open up, and allow more blood flow into an area that normally wouldn't have that much volume. And the other is nerves. These tend to be affected more by bones because of their intimate relationship physically to where bones and joints are, and how much those joint movements and dysfunction in the movements can affect the nerves. Soft tissues like muscle also affect them. Stress headaches we all know about. Like your head's going to blow up and you know what it's from. It's from all of the stuff around us. What we have to remember is that stress is the way we respond to things. Stressors are the things outside of us. The stressors are often things that we can't control. but how we respond to those stressors is where stress comes from, or what stress really is. There's no way we can talk about headache without discussing and examining some of the anatomy that's involved in and around the head and neck, because it is so intimately involved with the production of headaches themselves and the course that they take. So we're going to discuss some of the microanatomy and macroanatomy, the large and small parts of tissues and cells that get involved in producing and aggravating headaches. We think of blood vessels as tubes, and that's exactly what they are. Arteries tend to have muscular walls. They are under more pressure because as the heart contracts and pumps blood into the vessel, it needs to be able to expand and then contract back to its normal size again. Once blood passes from the artery through the capillary beds, now these are the tiny microscopic sized blood vessels that permeate every tissue in the body, everywhere. These vessels are so tiny that they only allow the passage of one cell at a time through the capillary vessel. Why it's important is because the arteries can dilate too far or too much sometimes because of the muscular content, and allow too much blood to flow into the capillary, which then stresses the capillary, increases pressure in the capillary, and can set off nerves and nerve endings around it, or can stress tissues that capillary is feeding. The structures of the head itself, and this is important because we want to see how the capillary beds interact with these tissues. If we look at where that word central nervous system is there, that's the skull. That's where the brain actually is. The first layer of meninges or coatings to the brain is the pia mater. The pia mater is rather like wet tissue, and it adheres to the brain, and it's part of the protective and nutrient tissue for the brain cells themselves. Above the pia mater is the arachnoid. Sounds like a spider. That's because the arachnoid mater has a web-like connection, a lot of tentacles sort of that connect it to the pia mater and to the dura mater above. The outer layer of meninges is the dura mater. It's named after pachyderm for the toughness. It is more of a leathery type substance. But between the arachnoid mater and the dura mater, and in the dura mater, there are an enormous number of blood vessels. These blood vessels permeate the dura mater, and if they overfill, they'll cause stretch in the dura mater because they actually increase the volume in the dura mater. We'll talk about why that's important later. Above the dura mater is the bone, the skull. Above the skull, the periosteum. Actually, it's not above. That's the outer layer of bone. Peri, around, osteo, bone. It's the outer layer of bone tissue, which is actually new forming bone cells. This image does not show the thin layer of muscle that lies between the periosteum and the skin, which would be the scalp, but there is a thin layer of muscle in there as well. Vascular events, these are events that cause vessels to expand or to contract, more commonly to expand. They cause the dura mater to be overfilled with blood. When that happens, the dura mater, which as we see is heavily perfused with lots of vessels, that causes the dura mater to stretch. Stretching of the dura, we know, causes the raging headaches. Oftentimes it's involved with migraines. Here's a look at just what some of the largest vessels in the brain have been colored for effect. The red ones being the oxygen-rich blood that's carried out to the tissues. And then it has to pass through all those tiny capillaries we just described and back into the blue vessels, which are the veins, which carry it back for reperfusion. Don't think there's a lot of vessels in the head? Take a look at this, and this is only the very large vessels that they could isolate and identify. As we study the anatomy of the neck and the head, especially the bony surfaces, at the top you can see we have the skull as it sits down on Atlas, or C1. Atlas carried the world on his shoulders. Atlas of the neck carries the head on its shoulders. And you see these two little joints on either side of the foramen magnum. Those are the facet joints that tie the skull to the cervical spine. The entire weight of that 14 or 15 pound globe up there is borne on those condyles, on those facet joints. You'll notice that Atlas C1 extends out much further to the side than any of the vertebrae below it do. And the mechanics between the skull and atlas and axis, which is C2, the second cervical vertebra, is completely unique to it in comparison to every other vertebra in the spine. The mechanics up here are really, really different. As we look at how these structures are built and how they're supported, we see these suboccipital, that's the occiput, which is the bottom of the skull, and the little muscles that connect to C1 and C2, and then C1 to C2, from atlas to axis, and from the skull to axis. And you'll see that these are a big part of how the head is moved and how it is carried on the neck. Another look at it from the side, you can see there are other muscles that attach to the atlas and the axis on either side. If we look at it from a chiropractic standpoint, the mechanics of this thing are so unique. You see the yellow nerve roots as they exit the spine. Well, there's another one that exits up between the skull and atlas, which isn't shown on the image. And if these joints become dysfunctional, for lack of a better term, where they're just not moving well, they become irritated. These are synovial joints, just like a knuckle in your finger, where they have a capsule that surrounds the joint. And if that joint gets a little irritated, a little arthritic, a little impacted because you slept a little crooked on a pillow, joint capsule will become inflamed. That first cervical nerve, the CO nerve it's called, and in fact the one below it, will both become impacted by the inflammation as that joint capsule swells and the inflammation gathers around it. Let's take just 30 seconds to appreciate the many layers of both functional and structural tissues that make up the support mechanism for the head and the neck. The brain and spinal cord are the control centers for the body. Nothing happens in the body that the brain and spinal cord don't mediate, from growing a toenail to scratching your nose. And here's an interesting little fact. Did you know that laid end to end, there are 100,000 miles of neurons in your brain? These neurons process 7 trillion signals every second. There isn't a computer on the planet that can do that. Headache pain can be more than just an annoyance. It can be debilitating. It can cause missed days of school, missed days of work, lowering your productivity, increasing your irritability with family, friends, co-workers. It can cause nausea and vomiting, which is common with migraines. It can even cause dangerous driving conditions because you wind up paying more attention to the pain than your surroundings. So we can talk about headache remedies, and everyone's had their own stories, their own approaches to how to manage their headaches. We've all had grandma's remedies come down with drinking water, which is not a bad idea when you consider the dehydration that may come into play. Drink something that's caffeinated, like a cola or a coffee. Caffeine is a vasoconstrictor, so when those vessels have dilated, caffeine can help to reduce that. Use ice. Take fish oil. Put peppermint oil on your temples. Eat ginger or take ginger capsules. And even take calcium or magnesium, which is not a bad idea, since calcium and magnesium are natural muscle relaxants, and a lot of headaches are tension related. The doctor says take aspirin or take Tylenol. They'll also say take ibuprofen, naproxen, which is basically Aleve. Again, drink extra water or take a walk. That may remove you from some of the things that are stressing you out. In extreme cases, they'll go to injections, Fioricet, Imitrex, Zomig, Botox. Botox is one that kind of makes me scratch my head. It is a toxin, and yet they will inject it. The allopathic approach, the MDs, according to a New England Journal of Medicine study, about 50% of the patients who received medication showed more significant improvement in their pain levels at 60 minutes, an hour later, over the group that received placebo treatments. But they have to deal with the side effects of the migraine drugs. They'll wind up with changes in taste, getting dizzy, lightheaded, drowsy, muscle aches, nausea, vomiting, chest pain, shortness of breath, and convulsions. In our office, over 90% of our headache sufferers, especially those with migraines, report significant, lasting improvement in pain levels between 1 and 30 minutes after adjustment. No side effects, as they see from drug interventions, and a much faster result. Other benefits of being adjusted: it improves blood flow to the brain. They've done what's called a pencil Doppler study on this, and found that the occipital artery increases in its volume after a successful cervical adjustment. Increased production of serotonin, which is the more focused, less stressed kind of hormone. Increased production of norepinephrine, which is the I'm in a good mood kind of hormone. And reduced blood pressure and release of endorphins. How much better can it get? There was a study done that was published in the Journal of Neuroplasticity that showed that adjusting the cervical spine causes changes in the activity of the prefrontal cortex. That's the conductor for the brain. That's the part that assembles ideas and coordinates thought patterns. Adjusting the spine increased 20% improvement in prefrontal activity, which leads to improvements in sensory motor function, that is how you feel things with your hands and feet, fall prevention, joint positioning sense, pelvic floor, and mental rotation of objects. And adjusting the spine has shown to augment or improve all of these functions. So why suffer with the headache? Chiropractic care is proven in the vast majority of cases and doesn't include any risks of drug interactions or side effects. I mean, what do you have to lose? Except your headache. Thanks so much for your time. If you or someone you know suffers from frequent headaches or any joint issue, feel free to give me a call. See if there's something I can do to help you manage your issues. Thanks so much and have a great day.